More than 6 million people in the U.S. are living with heart failure. It's deadly, but a new study has hope for reducing the risk of death with it. So joining us now is our medical expert, Dr. Payal Kohli. She knows a lot about heart stuff because, you know, she's a cardiologist.
I hope you know a lot about hearts. Otherwise,
it is your expertise. But, you know, when we say, how do we know if we have heart failure per se? How do we know?
So let's talk about heart failure. There's two types. What does the heart do? It pumps and then it relaxes, right? It's a pump. It pumps our blood around. So you can have the pumping heart failure, which is called systolic heart failure, or the relaxing heart failure where the heart gets stiff, which is called diastolic heart failure. But they both sort of present with the same symptoms. So it's really important to be tuned into your symptoms because that's how you're going to know shortness of breath, exercise intolerance, swollen legs, needing to sleep on extra pillows, anything that sort of suggests you're slowing down. Then you would come to someone like me. I would check a blood test looking for stretch in the heart and put an ultrasound probe on your heart to see is it stiff or is it weak.
Why sleeping with extra pillows?
Because when you sleep with extra pillows, some of that extra fluid regurgitates back into your lungs and you get short of breath. So people with heart failure, congestive heart failure, have congestion and they actually need extra pillows to help their lungs kind of oxygenate their blood a little bit better.
Oh, I do that for aches and pains. So that's why I was okay. I was just wondering, different. Okay.
Yeah.
those tests fascinate me because obviously they get better as time goes by, year in and year out. There are better ways to test, less invasive ways to test and learn more. I just think the term heart failure, when I hear failure, I mean like it's not working.
Yeah.
Right.
But it can be a slow degradation of how your heart works, that it becomes less efficient, less effective, and ultimately will fail.
Yes, exactly. No, so failure means that it's either failing because it's weak or it's failing because it's stiff. Now, the way that we age with our skin is wrinkles, the we age with our joints, they get stiff. Our heart gets stiff as we age. So what we're realizing is that we had underdiagnosed the stiff type of heart failure for many years. In fact, a lot of people walking around with high blood pressure, diabetes, sleep apnea, these types of conditions, and just even plain old age have stiff heart failure that we're now getting better at diagnosing.
And how well can you diagnose someone without having to really go into major testing or invasive testing? You can tell a lot from the outside looking in.
Very easily, which is why do not blow off symptoms. This is not age, this is not deconditioning or being out of shape unless proven to be, and you rule out common things like heart failure. And as our population is getting older, we're surviving more heart attacks, but we're also developing more risk factors like high blood pressure and obesity. This stiff heart failure is really going up, and up until recently, we didn't have a lot of options to treat it.
So there's a new study that's pretty exciting. And what does that do? What is it? It looks at heart failure or what?
Very exciting. So this is kind of a theme in medicine. We're studying drugs for something, and then we don't expect them to hit for something else, and they do. We see this
Ozempic.
with Ozempic, the weight loss drugs developed for diabetes hit for weight loss. We see it with Farxiga and Jardiance, which were developed for diabetes. They've also hit for heart failure. So this is for the stiff type of heart failure, which, like I said, until recently, before we got Jardiance, Farxiga, we had nothing for this. We used to just manage the symptoms, give you water pills, try to decongest the heart, just kind of deal with it. So now they were studying this drug, which was developed for diabetes and kidney disease, and they realized it works to reduce risk of death and hospitalizations in the stiff heart failure. So I'm really excited because we have so many tools now in our toolbox where we can change the trajectory so the heart doesn't keep getting stiffer.
So is this like still in the study phase though?
No, the drug is out there for diabetics who have kidney problems, so we're using it. But it's going to probably get approved in the next coming months for heart failure. And really what we're realizing as cardiologists, we used to focus just up here. We have to focus on the whole body because the heart, the kidneys, and your weight are best friends, I like to say. And if one is unhappy, the others get unhappy. So now we've started treating the whole person, and it's exciting to have all these medications to change disease that we've been struggling with for decades. And you know, people say if you end up in the hospital with heart failure, your life expectancy is actually shorter than most cancers.
Wow. Well, we're lucky to have a cardiologist who knows about the heart.
About heart.
That was a real bonus for the...
I just figured that one out, wasn't that?
Very enlightening start to our discussion today. Dr. Kohli, thanks as always, and we'll see you soon. Appreciate it.